My name's Jessie Lorenz. I'm the Associate Director at the Independent Living Resource Center, San Francisco. There are over 400 independent living centers in the United States, and the Independent Living Resource Center here in San Francisco, we are fortunate to be one of the first. We have been around since 1976. We provide service to folks with all different types of disabilities, but our primary focus is to make the greater community a more accessible, livable place for people with disabilities. We help people with Medicare and Medi-Cal issues. Those systems are actually pretty difficult to navigate, especially with the new prescription drug program. So imagine having to navigate that and not speaking English. Our staff help people resolve healthcare issues, find accessible, affordable housing. Many times people with disabilities are seeking information about things like technology. And my staff is trained to do triage and kind of break it down. Like, what is it going to take? What is it that you need in order to remain independently? Does a piece of technology exist? Who can pay for it? How can we get it paid for? If it doesn't exist, can we, what are some other alternatives? The population we have identified as the most underserved in terms of the disability community are Chinese-speaking people. They're in San Francisco, almost a third of the population are people that speak Chinese as their native language. And it's really important for us here at the Independent Living Center to both provide services that are linguistically appropriate, but that are also culturally appropriate.
Language. Language access is always the main challenge. Yeah, because all those agencies and government offices, they do not have Chinese languages speaking staffs. Not always, not everywhere. And even the articles, the materials they have, so many departments, they don't even have Chinese articles or materials or even forms.
One of the unique components of the Building Bridges program is a monthly column that we publish in the Tsingtao daily newspaper. Tsingtao newspaper is the biggest newspaper published in Chinese in this country.
My article is only once a month, and then at first they only gave me something like 300 Chinese words. I said, oh, it's just too little. And then every month is only one time, and then I think after several months I said, you must raise it. You must raise it to something like double it or whatever, because the articles, the Chinese are really looking forward to. Once a month, they said it's just too long. They've been waiting too long for it, and they really want those information. They badly need of those information.
Whenever that column goes out, the next day our phones just like blow up, which shows me that there is a truly an unmet need out there. These calls are not just coming in from San Francisco. These calls are coming in from all over Northern California, from people whose first language is Chinese, and they learned about our services, they learned about information regarding Medicare and Medi-Cal in the Tsingtao column. For people with disabilities living independently, I really feel that success is as simple as ABC. You have to have the adaptation, meaning that perhaps you need a ramp so that your house is accessible. Or for me, adaptation may be that I put Braille on the microwave. B, benefits. You have to understand and be connected to the benefits that you're entitled to, like Social Security or Medicare. And C, and I think this is the most important, and I think it's where we do well and still have work left to be done, that's community. To be a thriving, contributing person in society, you have to be connected to community. often what happens, people who are newly disabled lose that connection. So I think one of the unique things that our Building Bridges programs do is that they connect people who are perhaps even a little bit more isolated because of language. So that's a really, really long answer, and I'm telling you that I think it's as simple as ABC. Our Bridges program connect people with adaptations, benefits, and we keep people in the community.